Speaking.
Oh, adventures with his family, he's seeking, reporting weather, telling stories. Wherever he goes, it's the Ezra Speaking Show. Hello, everybody. Thank you for joining us on today's Ezra Speaking, where we have Dr. D'Hue. Come on in. Thank you, Dr. D'Hue, for being on our show today. Now, can you introduce yourself to us?
So I'm Dr. Zandra D'Hue. I'm the Director of Pathology of the Pathology Lab here and one of the staff pathologists.
Okay, now we are going to get into our 8-day forecast. So you can go on and do Saturday, Sunday, Monday, and Tuesday.
So it looks like for Saturday, it's going to be pretty hot Saturday and Sunday, but partly cloudy, so maybe it won't be blazing hot. And then Monday and Tuesday, we're going to have some scattered rainstorms.
Well, on Wednesday, we got a high of 86. Chances of some scattered showers on that day. 63 for the low. Wednesday is going to be partly sunny, but a chance of rain and storms. Thursday, we got no chance of rain or storms. So is Friday. We got a high of 81 and a high of 82 on Friday. We got a low of 62 on Thursday and a low of 63 on Friday. Now, on Saturday, we got a high of 82 and a low of 64. Going to be cloudy for Friday and Saturday. Thursday, partly sunny, but no chance of rain or storms there. Also on Saturday and Sunday, we got no chance of rain or storms there. Alrighty, so I want to give a shout out to the North End Cafe because we eat there sometimes and it's a really tasty place. So go there, check it out. Paul Page is the chef there, and so be looking for him. He has a card, his own card there. So now, Dr. D'Hue, I have a little quiz for you. Do you like cinnamon rolls better or muffins better?
Ooh, hard question. Can I have both? I guess if I had to pick, it would be muffins.
It'd be cinnamon roll for me.
But
it would be a muffin if it was chocolate, one of those chocolate muffins.
I agree.
And so they have their North End Cafe logo there. Now, here are the types of pathology. Now, I'm not going to probably be saying these right. I'm just going to guess. But then you can correct me.
Okay.
So, anatomical pathology.
Good job.
And here, you can read. This is like a little vocabulary, so you can read what that means.
Okay, so yes, anatomical pathology is what I spend most of my day doing. So that's looking at tissues from the operating theater, hospital wards, and post-mortem to diagnose disease.
So I know this. I know how to say this one. Chemical pathology. Do you do this a lot?
Yes, we have a clinical pathology lab where we do a lot of chemical pathology. And so that is looking at the blood for tumor or cancer markers, hormones, poisons, and therapeutic or illicit drugs.
Okay. Alrighty. This one might get me. Forensic.
You got it, buddy.
Wow. Forensic pathology.
Yes. So forensic pathology, I don't do personally. Forensic pathology, you do need a year fellowship after residency. And so that is a pathologist that investigates sudden or unexpected deaths for medical legal purposes.
Already, I'm gonna get this one. General and clinical pathology.
Exactly. So yes, general and clinical pathology means that you're trained across most pathology fields, which is myself. And it says these pathologists work in country regions and community hospitals, such as IU Health.
Okay. Yes. Alrighty. Now, I'm probably not going to get this one. Genetic.
You got them all. Yes, genetic.
Genetic,
Yes.
okay. Genetic pathology. Here, I can read this one if I can get that first word there. Analyzes human
Genes.
Genes for mutations.
Yes.
Mutations that cause disease to help personalize their medical care. Okay, now this seems like a funny one. Haematology?
It's hematology. Yes. And heme means blood.
So investigates and treats diseases that affect the blood, such as asthma, anemia, blood cancers, and clotting or bleeding disorders.
Yes.
Now, this one's going to be a little tough for me. Immunopathology.
Close. Immunopathology.
Immunopathology. I'm learning some words. I'm learning some words here that now I can say. It investigates and helps manage blood diseases, including autoimmune.
That's correct.
Autoimmune diseases and AIDS. Artie and I know this last one. Microbiology. It investigates and helps manages infect diseases caused by bacteria, viruses, fungi, and
Viruses. Fungi.
Why didn't I see that? I didn't see that there. Okay. And what's this last one for us?
Parasites.
Parasites. Okay. Now we're going to be looking through a micro later today.
Yes, through the microscope.
Of the microscope. Yes. And I have a picture of it right here. Yeah. Can you tell me more what a microscope is?
So it magnifies, well, you have to have a microscopic slide, and then you put it in there and it magnifies it by a certain amount. Depends, there's usually, I have about 4 magnifying lens on the microscope, so it'll magnify it 4x, 10x, 20x, and 40x. But I see this one has a 100x field, which we use a lot when looking at blood smears or looking for in the microbiology lab.
Okay. I have some questions for you.
Right.
Now, these aren't going to be tough, but I hope they aren't tough to you. True or false? Changes in blood flow represent the body's first response to injury.
True.
Yep. That was on the quiz. It said true. So I have one more question, and then we're going to head to the lab.
All right.
If you are not a pathologist, what would you be?
Well, what I'm thinking I want to maybe explore when I retire is a librarian.
Ooh. Yeah. Okay, now, everyone, we're gonna take we're gonna take our cameras, and we're gonna go to the lab. Like on a field trip to the labs. Right?
So this is where I come and do all the diagnoses. So this is my microscope, and
so I
kind of like a teaching scope because it has 2 heads. So you can look through here while I'm sitting here and
looking through that one.
Looking through this one, moving the slide, and I can teach and.
Do you think I could look through the one?
Yeah.
Wow.
So.
That looks so cool.
So this is your colon, or your large intestine. And this darker stuff, this is cancer. Yeah. So this is all cancer. Dark purple. So we use a stain, it's called H&E or hematoxylin and eosin. So it stains the nuclei like a dark purple, and it stains the cytoplasm pink. These white spaces are fat or adipose tissue. So this is the Anatomic Pathology Lab. So they take the tissue and they cut it up and they put it in these little cassettes.
What is this?
That's her microphone where she dictates what she's saying grossly.
But who does she say it to?
Basically, she's saying it to the transcriptionist, but really she's talking to me. Like, I'm going to read that gross description. And so I know what she saw grossly, and then I'm going to look at it microscopically.
What is this right here?
Oh yeah, so this is an important part of our practice as well. So this is called a cryostat. When we have a patient in surgery, for example, like I talked to a patient today who they had their uterus taken out and they weren't sure if it was cancer or not. So they'll send a piece of tissue to us. We freeze it at minus 20 degrees Celsius. It's very cold. And that makes it so that we can cut the tissue. And I can give a diagnosis while the patient's in surgery. So this is like the stains I was telling you about, hematoxylin and eosin. And then you go through a process of, this is alcohol.
Do they dip it?
Yes. So you can kind of see what that's that purple stain that stains the nuclei. Dark purple, and this is the eosin that stains the cytoplasm pink. So one more lab, our clinical pathology lab, which is where we do hematology and that we talked about, and chemical pathology. So this is the clinical pathology lab. Like we talked about, if you're looking for chemicals in your blood, this is our blood bank. So this is where we keep the blood for like massive or for any for transfusions.
There's a lot to have.
Yep.
5 different people that take care.
Thank you, Dr. D'Hue, for being here today. I would like to give a special gift to you for being on our show, for being on my show. So I would like to give you
Oh wow! Thank you.
your own weather
That
chair.
is so kind. Thank you very much, Ezra.
Alrighty, so thank you everybody for watching today's video. Please follow the IU Health page on Facebook, and please subscribe to Ezra Speaking. Thank you, Dr. D'Hue, for being on our show. Everybody, see you later. Bye. Smells good.